Steph, thanks. May is Melanoma Awareness Month, so what can you do to prevent this deadly form of skin cancer? Joining us this morning to keep us healthy is Dr. H.P. Makkar, dermatologist and Mohs surgeon at the UConn Health Center. Good to see you. Thanks for coming in on Memorial Day.
It couldn't be a more appropriate day, right, with the great weather.
And it's important. Now, the first question is, straight out, we've all heard of skin cancer, but what is melanoma specifically?
So there's three main types of skin cancer. Melanoma is the most serious kind. It comes from the cells that produce pigment called melanocytes. It can arise in normal appearing skin or else from a mole that's pre-existing that's changing.
Now, we all like to find out who is at risk. We all like to hope that we aren't at risk. But you had this great line in your notes. It said, if you have skin, you're at risk, and that basically includes everybody.
Absolutely. There are some factors, however, that will increase your risk for skin cancer. These include being Caucasian with fair skin, light eyes, so blue eyes or green eyes, red or blonde hair, having a family history of melanoma, so if someone in your family, a parent, a sibling, a child, that will increase your risk for melanoma. Frequent sunburns, especially during childhood, may increase your risk for melanoma. These are all things that could potentially be warning signs.
And you see that a lot in the older generations, and I'm throwing myself in that group because we got sunburns. We put on sunscreen, yes, but maybe not when we were younger, in the 80s and stuff like that. And you do see a lot of melanoma in people our age.
Absolutely. So melanoma incidence on the rise, especially in younger people.
Let's talk about those warning signs that you at home can look out for to see if you should go see a dermatologist.
Self-examination is key, and if you can think of the first 5 letters of the alphabet every time you look at a mole, A, B, C, D, E, that will help guide you to determine if you need to seek care. A, asymmetry. If one half of your mole looks different than the other half, that can be a sign of something worrisome or more ominous. Border. Is the border regular, which may signify a benign mole, or is it ragged or notched? Color. Is the color even, or are there multiple colors? Brown, black, tan, red. Diameter. So most melanomas are greater than 6 millimeters in size. Now 6 millimeters, for those of us who aren't too metric, is bigger than the size of a pencil eraser head.
Okay.
But some melanomas are diagnosed earlier. And then E, evolving. Is your mole changing? Is it itchy? Is it bleeding? These can be warning signs.
Oftentimes we think, oh, it has to be a part of the body that is exposed, but my uncle, I was telling you before we went on, he was diagnosed with melanoma. He went to the doctor, said, how did I get this? He said, there are people in Sweden who get it in the back of their legs, and they're covered up all the time. So basically, that said, where do you need to look on your body? So
for men, the most common spot is the back, and for women, it's the legs, but it can occur in covered skin as well. So self-examination is key, and it can occur anywhere.
You go, you think you have something suspicious, you go to the doctor, it turns out it is melanoma. What happens from that point on?
Well, typically melanoma is cured with surgery, especially at the very early stages. So you would then typically see a surgeon to have it removed, and most people do very well with an excellent survival rate. It's once melanoma spreads to your lymph nodes and distant organs that the survival rate falls off.
So, as with all of these types of dermatological issues and most health issues in general, early detection is key.
Absolutely.
Doctor, thank you so much for coming in on your Memorial Day. We really appreciate it. Hopefully folks out there will get some information they can take with them to stay healthy this summer. Steph, back to you.